please you join, ma'am. Please you join.
Okay, then I'm
Can I ask one question?
We still 5 minutes or more. We are doing the informal discussions.
Can I
So
ask
it's
a
not.
question, please? What's going to happen? Is this curtain is going to open?
What is it?
When the meeting starts, is this
Okay.
curtain is going to open? Okay, I got it.
No. This is just have a look, madam. Just I'll show you once. You just go through.
I got it.
He is going to share the slideshow. Then you can see the slideshow.
Okay.
Muthu is going to Mr. Muthu is going to have the show the slideshow.
Okay.
And listen to all of you.
Ma'am, please join, ma'am.
I am.
Welcome, everybody. Hello. We will start.
Just a minute, madam. Just a madam. Khanna madam has to join.
Yeah.
Just joining.
I can't see Alka. Where is Alka?
No, ma'am. Actually, madam is on my phone, ma'am. Actually, through WhatsApp call, she is online.
Okay.
I'm almost there.
Yes, ma'am.
Good morning. This is
Good
Ruma.
morning.
Good morning, ma'am.
Good morning, ma'am.
Good morning. Good morning.
Everybody.
Vimla, I'm really missing you.
I miss you too, you know.
Yeah. Good morning, Bimla madam. Good morning. Very nice
Hi,
to see you.
morning. Sudha, how are you?
Good morning, ma'am.
Bimla, good to see you.
Ma'am, PPT is visible now.
Good morning.
All are visible, but I can't see.
Yeah, the PPT is not. You can share PPT, Muthu, so that we can see that it is visible to
Could you
everyone.
put me in?
Yes, ma'am.
Have you put Dr. Khanna in, Dr. Muthu?
Yes, madam. Madam is in, I feel, ma'am. Just a minute, ma'am.
Just check once more, please.
Yes, ma'am.
It says no meeting.
Ma'am, you are in, ma'am. Khanna, ma'am.
But we cannot see her.
Just a minute, ma'am.
Your device is running low. I don't know what is it.
Ma'am, please on your camera.
Madam Narula Khanna is there present, but her video is off. Unmute your video, Madam Khanna.
Yes, please. I am here, but I cannot get.
You have to
There is
unmute your
something-
video, ma'am.
Ma'am, I have
Unmute
shared
your
it.
video, please, so that we can see each other.
Yes, madam. Yes, madam. Perfectly.
Oh,
Yeah, we can see now.
Good morning,
We can
ma'am.
see you now.
Good morning, ma'am.
Why don't you guys start, please?
But you are
Just a
here.
minute, madam. Just a minute.
Dr.
Good morning,
Khanna, you are
madam.
already here. Good morning.
As soon as I get it, I will.
No, you are there. Dr. Khanna, you are already there.
We can see you, madam. Good morning.
Oh, you can see me, but I cannot open my icon, or there is no icon for me.
Oh.
Now you got, madam.
Yes, I got it, but there is no. Just a second. Thank God.
Sometimes it
Good morning, ma'am.
happens.
Khanna, ma'am.
Good morning.
Yes, very good morning.
You disappeared.
Good
Yes,
morning,
ma'am.
Good
ma'am.
morning, ma'am.
Good
Good
morning.
morning to all of you.
Good
Good
morning.
morning.
Good morning.
Good morning.
Am I visible now?
Yes,
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 madam.
ma'am.
You are busy.
You are visible.
Thank God. I can see Prerna ji. Oh,
Yes, ma'am. I'm here. Yeah.
why it is getting disconnected, I don't know.
You are not disconnected. You are there
No,
with
you
us.
are there, ma'am.
Okay. So are we starting?
Yes, ma'am. If you
Yes,
give
ma'am.
permission, we can start, ma'am. Bimla, ma'am. Asya, ma'am.
Yes, ma'am.
Yeah, you
Yes,
can
ma'am. Good
start.
morning.
Khanna, ma'am. Can we
So-
start?
Good morning, Swati.
Good morning, ma'am.
Hi,
Very good
Elsie,
morning.
please start.
Yes,
Hi,
ma'am. Okay.
Alka.
Good morning, ma'am.
Good morning, ma'am. Good morning.
Good morning.
Good morning.
Am I audible, sir?
Yes, yes, madam. You are audible.
Okay.
Yes.
Shall we start?
Khanna
Yeah,
ma'am,
we can
can we?
start.
Yes, ma'am.
Yes.
Okay. Very good morning, heartily good morning to all. I'm very glad and fortunate to address our today's guest on this event. And we are gathered here for the International NSS Chapter Carnation 27 for our this NSS event. It is esteemed honor to be here and overwhelming opportunity to nourishing of new chapter coming and upcoming new nurses and all experts here. So first and foremost, I would like to start with the God. God never said that the journey will be easy, but He did say that the arrival will be worthwhile. So first and foremost, I would like to heartfelt welcome to our chief guest today, Dr. Ashia Qureshi, Chapter Advisor, Carnation 27, SNT President, NSS, and today's guest of honor, Professor Dr. Rajni Chaudhary, Chairman by Laws Committee, and Professor Dr. Bimla Kapoor, Senior Advisor, NSS. So time may pass, season may come and go, but memories of you will stay forever. So I would like to thank you of our today's this NSS founder, Chief Patronage ma'am, our founder ma'am, Narulla Khanna ma'am, and Binu Joy sir to give me this opportunity to attend this event. Next slide, sir. So personality is one only permanent thing in your ultimate and temporary life that all more reasons to cherish it. It is said by Isabella Portes. So if we see today's our Ashia Qureshi ma'am is the personality of today's event, that is our chief guest, and we would like to welcome all speakers, keynote speakers, and today's speakers and all members of this Carnation chapter. So this is about our launching of ceremony. So I would like to congratulate to all members and experts present over here that we have launching a new chapter for international chapter, and it is an honor for all of us. Next slide, sir. So these are the, we can see the places, beautiful extent of that internationally we are connected now. This is my profile, that is I'm Mrs. Swati Patanwal, working as an assistant professor in Government Nursing College, Jalon. I'm working as a professor in the Rajki Medical College since, and I having experience of a 15 years experience, but I have so many research studies and journal and written so many books. I'm going through to the NSS patron NSSC Professor Narulla Khanna under the guidance of her. I'm doing this master of ceremony today. Next slide, sir. So now I would like to carnation flower meaning, what the word meaning of this chapter name, that is fascination, distinction, and love. So love is a sign of symbol that we have seen. This is the history and objectives of today's chapter. So now I would like to call all members of the Carnation chapter to come individually and give their specific profiles. And so first of all, and first and foremost, I would like to call Professor Dr. Usha Rai, that is chapter president of the Carnation. So as we say that time will not change, but bond we share will be always find our way back together. So this is the, I will call you Usha Rai ma'am, or chapter president of this chapter. So please ma'am, so next slide.
No, you just go through the brochure, ma'am. You please tell the brochure.
Okay. So this is
You can go to
today's
the brochure. Actually, in the brochure, whatever we have put the prayer and everything,
Yeah, that you
and
should,
the
accordingly
objective
we'll
and
go through.
vision and mission, you can do that.
Yes, yes, ma'am. Yes, ma'am.
Yeah.
So this is the brochure that
You
is.
have to. You also have to give the introduction of Madam Usha Rai also before
Yes,
she
madam.
comes and give
Yes,
her
yes,
message.
yes, yes, yes.
Yeah.
Yes.
Just continue.
Yes, ma'am. So, chief guest of this event that is Professor Dr. Asha Qureshi, chapter advisor, Ganesha 27, SNT president, and guest of honor, as already I told, that Dr. Rajni Chaudhary, chair by Laws Committee, and Professor Dr. Bimla Kapurji, senior advisor of NSS. We welcome you, ma'am.
Swati ji, just you have to mention that Professor Dr. Asha Qureshi ji is our chief guest. It is written top. She is
Yes,
chief guest Qureshi today.
Yes, ma'am.
So Atiji, one thing you should do that you go according to the slides which are being prepared. You go according to that because we are missing so many things in
The next
between.
slide. Go
The
to the
prayer,
next.
yeah. The lighting the lamp and all those things we are missing.
Yes, ma'am.
Swati, go to the next slide, please.
Yes, madam.
And keep going.
So-
Keep going. We
Yes,
all
ma'am.
know.
Yes, Swati
Keep
ma'am, please
going
go ahead.
according to history of NSS and all.
History of NSS, then Nursing Scholar Society of India was established after SEAM Giver founder Dr. Khanna spoke with the president, PhD scholar, Principal Binu Choiser. He, with his unwavering determination and enthusiasm, took the responsibility to make this vision a reality, and with the result, they managed in such a short time to get the desired executive committee members in founders circle and regular member to meet the requirement of the registration in Rajkot headquarters in Gujarat. The society has been registered and pretty soon. Next slide, sir. So the objective we see of Nursing Scholar Society's main aim is to society is to encourage and recognize the scholarly skills of the nurses in writing and speech and community services. Nurses must be a license holder starting from A&M and PhD for variety of INC recognized program. They shall be from all sphere of nursing professions such as education, clinical practices, administration, research, community services, or midwives. These nurses must be trained in India and maybe now residing abroad, and the society shall include global nursing professional members in honorary that members' capacity. So, form chapter in CARE state and group of colleges get affiliated with the other national and international nursing societies, have scholarly paper study presentations. So, this is time for lamp lighting. So I would like to call all dignitaries and all experts and today's chief guest and guest of honors, please come upon for the digital lamp lighting.
Yes, carry on.
Yes, Swati ma'am.
Yes.
Swati ma'am, you are there? Swati ma'am, you are there?
Sir, I thought some network issues over there with ma'am.
Okay.
Why
Good
don't
morning
you
to all.
continue?
Yeah, ma'am. I'll continue. Not a problem.
Yeah, Bithuji, you can now give the
Yes,
introduction of Madam
yes.
Khannaji.
Good morning to all respected dignitaries. It's my privilege to introduce our beloved patron, ma'am, Professor Dr. S. Narula Khanna, ma'am. Madam has received doctoral degree from International Renowned Columbia University, New York, after completing initial GNM in Delhi and post-basic PhD PGI Chandigarh. Madam have 45 plus years of professional experience in variety of settings such as teaching, clinical administration, research, and management in 5 different countries, that is India, Canada, USA, Italy, and Holland. Madam is a life member of many national and international societies. Madam had been a chapter president of Sigma Theta International Nursing Honor Society and TNA Overseas Branch, USA and Canada. Madam has represented TNA as a national representative at the United Nations also. Madam has published extensively in referred journals and authored one book on perspective of history in India and Indian leaders from 1947 to 2024. That is in third edition. and
அப்பப்பா
printing.
பண்ணுங்க, நான் வந்துடுறேன். சரியா?
May I know who is this?
Mute.
Yes, Muthuji, you can continue.
You are muted.
Yes. Now is audible, ma'am? Okay.
Yes.
Awarded and felicitated numerous times of including recently in Surat, Rajkot, Harda, and Delhi by various NSS chapters and societies. Actively involved in enhancing a mission of NSS, which is care for the caregivers, nurses. I request you to give your valuable message, ma'am. Khanna, ma'am, over to
Thank
you.
you for the introduction. And respected dignitaries, National President, Professor Dr. Binu Josar, Chapter President, Mrs. Usha Rai, Chapter Vice President, Dr. Navkiranji, our Chief Guest, Chapter Advisor and SNT President, Professor Dr. Ashia Ji, our guests of honor, Iron Lady Professor Dr. Bimla Kapoor Ji and Professor Dr. Rajani Chaudhary Ji, all special guests, permanent board members, organizing team, and a lovely audience. Greetings to all. Today is a special Himalayan day as we are going to embark on special dimension of our NSS by induction of International Carnation Chapter number 27. I'm so thrilled to be here as a part of this ceremony. In past 3 years, we have worked so hard as a team to enhance our society mission, which is care of the caregiver. I will be joining you later in the section of induction, and my best wishes and God's blessings to all of you presenters, keynote speaker, and guests, and our audience. Okay, on to
Thank
you,
you.
Muthu sir.
Yeah, thank you, ma'am. Thank you so much for your blessings, ma'am. Now I take this opportunity to introduce our National NSS President, Professor Dr. Binu Joy, sir. Dr. Binu Joy, sir, is a gold medalist and he is currently working as a principal in Rajkot. And sir has a 16 plus years of professional experience and is actively involved in enhancing our NSS mission. Sir has conducted many national and international workshops and had been a key proponent in our successful recent international conference in collaboration with Vibrant College of Nursing in Surat. Sir has published many research articles in reference journals and has authored a textbook on pediatric nursing. And Sir is a lifetime member in many prestigious professional societies on editorial boards of referred nursing journals. Sir is a pillar of our NSS society. I would like to invite Binu sir to give a valuable message. On to you, sir.
Respected dignitaries, a very warm greetings of the day. Respected Dr. Ashik Qureshi ma'am, Chief Guest of the day. Respected Patter ma'am, Dr. Suresh Narulakhana ma'am. Our senior advisor, Dr. Bimla Kapoor ma'am. President of the Carnation Chapter, Mrs. Usharai madam. A very warm greetings of the day. Yes, it's really very proud moment and a very joy moment for the History of Nursing Scholar Society as we are going to established our imprints outside India also. As we mark the induction ceremony of our first international chapter in USA, good wishes from the entire executive founding members of the nursing for the successful induction of our new chapter. Good wishes for all the office bureaus and the committee members of the chapter. Hope you will enrich and envision vision of our objectives of our nursing scholar society. Good wishes to all the members. The main vision of the Nursing Scholar Society is care to the caregivers and to establish the scholarly activities in the research field. I would like to take this opportunity to thank all the members who are going to be inducted today in Nursing Scholar Society. Request to please as per the vision and mission of Nursing Scholar Society. Thank you.
Thank you, sir. Thank you so much for your blessing, sir. Now I take this opportunity to introduce today's chapter president, Ms. Usha Rai ma'am. Madam has a graduate from India from Hindu Rao Hospital, Delhi. She worked as a nurse educator in same hospital, and Madam dedicated a compassionate service to the mankind is well appreciated. She is a member of TNI for 3 decades. She worked in USA as a clinical nurse and cardiac care unit and specialized in advanced CPR certified by American Heart Association. And her approach towards the patient care is unique. And Madam, you are most welcome to our NSS family. It is our pleasure that you have accepted the position of President and Carnage chapter. I would like to invite for Madam's message. Over to you, ma'am. Usha, ma'am.
Thank you, Mr. Mutu. Thank you, Dr. Su Narula Khannaji. And thank you, Mrs. Asha Qureshi ji. Good morning and greeting from USA. Dear NSS family members, as your president, I would like to enthusiastically welcome all my team executives who are part of this new International Coordination Chapter 27 USA. I would like to congratulate all the inductees who will be facilitated in today's event. I feel it's a tremendous honor to serve as your president of Coordination Chapter 27. I'm so pleased to be part of this society. It's my hopes, desire, and dreams that we all move forward in promoting nursing education, research, administration, and providers of healthcare in the hospital, community, and in all healthcare settings worldwide. Nursing Scholar Society is a high quality, registered under Society Act, constitute of nursing professionals of higher caliber and great leaders of national and international level who are highly motivated to make positive, influences in the nursing profession. I hope together we can reach great horizon. Thanks to patron Madam Dr. Su Nurullah Khanna, Dr. Aisha Qureshi, and other executive at headquarters level for providing me this opportunity to be the part of this prestigious society. I would like to congratulate once again to all the members of who will be inducted today. Thank you very much.
Thank you, ma'am. Thank you so much. Now I take this opportunity to introduce our today's chief guest, chapter advisor, and SNT president, Dr. Ashiya Qureshi, ma'am. Madam always be with us. Always, if anything, she'll be guiding us. Madam is a well-known nursing leader, seasoned publisher, and expert researcher. Ashiya Qureshi, madam, has been associated with Galgotia University since 2014 till 2021 after rendering 45 years of services at AIMS. Madam has to her credit professional experience for over 50 years, and Madam has completed her PhD in public health, and even Madam has completed MBA from Modern Institute of Management, Newport University. She joined AIMS in the year of 1972 and retired as a professor after superannuation in the year of 2014 October. Worked at various capacities as PHN with WHO project, clinical nurse, educator, administrator, researcher at AIMS. Her area of interest includes community health nursing, nursing education, nursing administration. She has her credit more than 30 research publications in national and international journals. About awards, she has been awarded with the Mahila Shiromani National Award from President of India in 1995 for the best community and patient care services. Rajiv Gandhi Excellence Award from NRI Society of India in Delhi from Health Minister for best community voluntary services. And Lifetime Achievement Award during International Nursing Conference 2017 and Excellence Legendary Mother Teresa Award from NRI Society presented by Lord Swaraj Paul 2019. Lifetime Achievement Award from Nursing Scholar Society in the year of 2020. Life member of 20 professional bodies such as TNI, NRS, INSS, PHI, World Population, Geriatric Society, Global Health Conference, USA, and many more. Participated as a resource person in almost 50 conferences nationally and internationally. Madam was a BOS member in various university selection committees members, written many books and journals, and completed OB, HRM, TV certification program of 6 months from Nepal Swayam platform with gold award during her tenure as Dean at Galgotia University. Secretary NS chapter and joint advisor at headquarter level, NS advisor for J&K chapter, SNT president at NS headquarter, advisor for Carnation chapter 27. Over to you, ma'am, for your message. Ashiya, ma'am. Ashiya, ma'am.
Okay. Am I
Yes, ma'am.
audible now?
Yes.
Yes, ma'am. You are audible, ma'am.
Yeah. So thank you, Muthu sir, for your kind introduction. Respected dignitaries, National President Professor Dr. Binu Joseph, Chapter President Mrs. Usha Rai, Chapter Vice President Dr. Navkiran ji, our guest of honor Iron Lady Professor Dr. Bimla Kapoor ji, and Professor Dr. Rajni Chaudhary ji, all the special guests, permanent board members, organizing team, and lovely audience. Greetings from New York. Namaskar. Today is a very joyous day for all of us. NSS family has grown and we have launched the Carnation International Chapter 27 for which we have gathered over here. My heartiest congratulations to all the new members in our family who will be shortly inducted and facilitated in today's induction ceremony. I'm going to highlight on the WHO theme 2024. This will be the message of mine today. Around the world, all of you know, the right to health of millions is increasingly coming under threat. We all know that. Diseases and disasters loom large as cause of death and disability. Conflicts are devastating lives, causing death, pain, hunger, and psychological distress. The burning of fossil fuel is simultaneously driving the climate crisis and taking away our right to breathe clean air with indoor and outdoor air pollution claiming a life every 5 seconds. You can see this is a theme, My Health, My Right. If you see the slide, this is a WHO theme of this year, and this is a global call to emphasize a fundamental human right to everyone and access to quality health care. The key messages, I will be very short because somebody is going to talk about it, on this particular topic. I will just give you the key messages which the World Health Organization want all the professionals to do. Health for all envision a society in which all the people have good health and may live happy lives in a peaceful, wealthy, and sustainable environment. The right to health is a fundamental human right. Everyone must have access to health care when they need it without financial burden on them. 30% of the world's population lacks access to basic health treatments. Almost 200 crore people are facing catastrophic or impoverishing healthcare costs, with considerable disparities impacting those in the most disadvantaged circumstances. Universal health coverage provides financial security and access to high quality necessary services, lift the people out of poverty, promotes family and community well-being, safeguard against public health emergencies. To make health for all a reality, we need individual communities with access to high quality health services so that they can care for their own and their families' health. People-centric care and policymakers who are committed to investing in universal health coverage. So, by keeping all these key messages of World Health Organization in mind, let us take pledge today to take care of your own health first and then to take care of the health of the individuals, families, society, and community at large. When we will be healthy, we can take care of everyone. So, with this message, I think I should congratulate and congratulate to all the inductees in today's ceremony and the lifetime achievement awardees also. So, thank you so much.
Thank you, ma'am.
God
Thank you
bless you
so
all.
much thank you so much for your blessing, ma'am. Now I take this opportunity to introduce our today's guest of honor, Professor Dr. Bimla Kapoor, ma'am, and our always she is a guide for us always. Madam has extensive experience in the field of nursing education, research, and administration, more than 4 decades. Madam has completed her PhD from IGNO. She has a chairperson committee of experts in National Nursing Bill 2020 with the Minister of Health and Family Welfare, Government of India. Madam has been an active member of TNI throughout her career. Madam is a life member of various nursing societies and associations. Madam is a consultant to many universities and NGOs. Her achievements awards include first book author of textbook of psychiatry nursing volume 1 and 2 and 1 2 established the Delhi Nursing Council, 3 started higher degree program of nursing in many countries, presented Presidential Gold Medal Award for MSc Nursing and awarded TK Pinnawala Prize for Research and inducted in Sigma the International Nursing Society, awarded for excellence in nursing from Nehru Foundation. Over to you, ma'am, for your message, valuable message, ma'am.
Thank you so much, Dr. Muthu, for elaborating on me and my achievements and reminding me that there is much more I need to do. Dr. Khanna, our patron, Dr. Aisha Qureshi, the advisor for the international chapter, and also the heading our society for student enhancement, increasement, and Dr. Binu, our president, national president, and also I think you will take care of the international chapter also. Dr. Alka, our secretary, and all executive members. Usha Rai, the president of international chapter. Good to see you, Usha. Navkiran, also the who is taken as, and all the executive members. To me, today on a World AIDS Day, today is a World AIDS Day. I feel that boundaries has nothing to do with the expansion of the philosophy, objectives, and also the mission of a particular society or particular organization. And I think our nursing colleagues have proven it today very well that wherever you are, wherever we are all together as nursing professional. And congratulations to Usha Rai for taking leadership and seeing that so many people have joined as part of our chapter, Carnation chapter. My also congratulations goes to Dr. Khanna and Dr. Aisha Qureshi for making extra efforts to see that the chapter is inducted today on 1st of December, though every one of you are busy early in the morning and also some of you need to go to sleep. But all of us, we are here to see that we understand our philosophy and objectives and see that across the world we are able to help our nursing professional care of caregiver, which is our philosophy and aim. Uh, I also feel that so many enthusiastic nursing professionals are there. That means that fire is still there in us, that we try to bring the change. We try to inculcate those kind of values, what we had learned, and also see that the profession grows very well. With this, let me congratulate each one of you and congratulate our new president, Usha Rai, for taking the leadership of seeing that a lot of activities will go internationally and probably will meet soon in India and somewhere abroad. Congratulations once more. God bless you. Thank you.
Thank you, ma'am. Thank you so much for your blessings, ma'am. Uh, Now I take this opportunity to introduce our second guest of honor, Professor Dr. Rajni Chaudhary, ma'am. Rajni Chaudhary, ma'am, is a nursing professor, mental health coordinator, and registered nurse. She works for Dallas College in Dallas, USA. Madam has also works for Accent Learning as an NCLEX educator specialist and travels all over the USA to teach NCLEX courses. Dr. Chaudhary ma'am completed her BSN MSN from RK College of Nursing, moved to the USA in 2004. She worked in ICU for 5 years before transitioning to a nursing faculty position in 2009. In 2020, she earned her DNP from Grand Canyon University. As a part of her DNP, she researched for fall prevention in middle-aged groups, published in peer-reviewed journals in USA. She has also published articles, thalassemia in international nursing journals. Dr. Chaudhary, ma'am, has been a speaker at 2 international conferences, including serving as the keynote speaker at 6th World Conference on Nursing Education and Healthcare in Rome in November 2022. She is actively involved in various committees at her college and socially engaged in efforts to uplift the community. Dr. Chaudhary, ma'am, has changed the lives of many nurses by helping them get US nursing license through training. Dr. Chaudhary ma'am is a creator of Women's and Empty Nester Social Travel Group, which promotes travel and healthy living among these groups. I invite you for your valuable message, ma'am. Over to you, ma'am.
Okay. Thank you, Mithu Sarji, for my kind introduction. I'm glad to listen that NSS is one of the best association that take care of caretakers. I am thrilled to be a part of NSS and congratulate all members on establishing a milestone chapter in USA. In future, we look forward to enhancing the nursing profession through various platforms and initiatives. For example, we can do educational exchange programs, research collaborations, training and professional development, standardization of practice. Can you hear me, please?
Yes, ma'am.
Yes,
Please,
yes,
please
we
go
can
ahead.
hear you.
Okay. Okay.
Please mute yourself, please. Please, ma'am. Please go ahead.
So we can do policies and advocacy efforts, technological advancements and resource sharing. We can also do a cultural competence programs. At the end, I will say that initiative taken by NSS will foster mutual growth, enhances healthcare delivery, and strengthens the global nursing community. Thank you so much.
Thank you, ma'am. Thank you for your valuable message. Now I take this opportunity to give a self-introduction of 8 permanent national board members. First, already Binujay sirs already we have given. Next, I would like to call Dr. Priyesh sir. Sir, you are there? Priyesh sir, you are there? They are the 8 permanent national board members, Professor Binujay sir and Dr. Priyesh Jain sir, Professor Dr. Alka Tajne ma'am and Dr. Anu Jaykutti ma'am, Professor Dr. Santosh Yeshu sir, Professor Dr. Sudha Singh Mohi ma'am, Mr. Himanshu Trivedi sir and Misala Kuntala Saha madam.
Call the next then, Alkaji.
Okay, I'll call directly. I'll go to Alka madam. Yes, madam.
Good morning, good evening to one and all.
Just a minute,
Everybody
ma'am.
here.
I'll give your
Dr.
introduction, ma'am.
Our patron.
Ma'am,
Okay.
I'll give your introduction. This is about myself. Actually, I'm the second part of MC. Just I'll go through my message. A warm greeting to all being a member of this prestigious society which cares for carers and honors their dedication by inducting them into a Hall of Fame. Brings me a great pleasure and delight. I want to congratulate each and every chapter president and member of the national governing body who works so hard to advance society and disseminate it throughout the country. Now it is across the globe. I am grateful to the chief patron, ma'am, Dr. Shukhanna madam, National President Binu Joy sir, and obviously Dr. Bimla Kapoor ma'am, and Dr. Ashik Kuroshi ma'am for providing a great platform for nurses, nursing professionals to advance their scholarly abilities, leadership, education, and research through this society. I also congratulate all the inductees of the today's chapter, Carnation Chapter 27 International, to work and coordinate with legends of nursing professional across the globe and to promote professional nursing activities. I would like to thank all our executive members of all the chapters for their immense support. Now, I take this opportunity to introduce our today's keynote speaker, Dr. Alka Tajne Madam. Alka Tajne Madam is currently working as a principal in Vibrant College of Nursing, Surat, Gujarat. Madam has rich experience of teaching of more than 22 years. Madam is Secretary General of Nursing Scholar Society. Madam is a editorial board member of various national and international journals. Madam is a lifetime member of PNFI, and many more prestigious nursing societies. She is registered as an external examiner in Gujarat Nursing Council. Madam is also registered as a university inspector for various nursing institutions. Madam had published many research papers in national and international journals of nursing. Madam was awarded with the Best Nursing Staff and also Best Teacher Award by Ujiri Academic Research Foundation. Madam has completed various certificate course of nursing. Madam has published a book on applied anatomy and physiology and BS nursing, currently working on pediatric nursing book. Madam has organized various state and national conference. Now I invite Madam to give her message. Ma'am, over to you, ma'am.
Muthu sir, 1 minute, please. go
ma'am.
back to the 8 permanent board members, please. There are some very ready to read their profiles. Kuntalaji is there, Alkaji was
Yes, ma'am.
there. So call on, and if they are all not there, then we come to that. Please go back to that.
Yes, ma'am. Dr.
Kuntalaji
P.S. there is a
was
ma'am.
right there. Go to the list.
Yes, madam.
Yeah. Alkaji, are you going to say something?
Yes, ma'am.
Yeah, just 1 or 2 minutes because I want
Thank you, Muthu sir.
national people to be knowing
Yes.
them.
Yes, ma'am. Good morning, good evening, everyone. This is Dr. Alka Tarne. Already Muthu sir have given my introduction. I'm working as a Secretary General in our National Nursing Scholars Society. And I'm very happy that today we are going to open. I congratulate Dr. Usha Rai madam and all the team members. Thank you so much.
Thank you, ma'am. Thank you so much. Anu ma'am, you are there?
Anu Joy Kutti.
Yes, sir.
Ma'am, please, ma'am. Your profile, ma'am. Ma'am is a treasurer actually. Anu ma'am.
I asked Binu sir to read for her.
Yeah, Binu sir, please, sir.
Good evening. It
Yeah.
gives
Sir,
me an
please.
immense pleasure to read my wife's biodata
Yes.
only. So, Mrs. Gianu Joykuti is a very
Yes, sir.
energetic professional
Sir,
who always stands.
I'm
Yes,
back.
you want to read? Oh,
She's here.
okay.
Yes,
Great.
sorry for the interruption. So a very good morning to one and all. Greetings of the day. Myself, Dr. Anu Joykuti, working as the treasurer in National NSS. I am so humbled to be over here in this induction ceremony of our international chapter. So congratulate all the inductees, and also we, the NSS family, together we can strive for the excellence in our practice, for the latest research and best practices, and let us all together we can make this profession, our profession, a positive impact throughout this journey. And I have completed my graduation in 2008 and post graduation in 2012 and PhD in 2023. So very happy to be in this part, and a great thanks for our patron madam Isha Qureshi ma'am, Bimla Kapoor ma'am, and all the inductees, and great congratulations to all our international members, Usha ma'am, Chaudhary ma'am, all of you, and hope to work together with all of you for our profession. Thank you so much.
Thank you, Anu ma'am. Now I take this opportunity to give self-introduction, Dr. Sudha Singh ma'am. Ma'am, please. Sudha ma'am.
Good morning to all the respected members of the NSS family. Myself, Dr. Sudha Singh Moe. Currently, I am working as Principal Director of Sri Swami Samarth Nursing and Paramedical College, Harda. I had published various books, and in my future goal, obtaining challenging and responsible position in professionally managed organization, and have opportunity to utilize my skills effectively to contribute to the success of the industry, organization, society, and all. I am heartily congratulations to all the respected executive members of our new chapter, which is going to be started in at international level. And I congratulate and give my grateful regards to our beloved patron, Dr. Su Khanna madam, who at this age she's providing her services and support to all the nursing professionals to make interact with each other in this platform, and make this moment happen, that our NSS family, not in our country only, but beyond the boundaries, we are now in touch with each other and make the aim and goal of this society that care for caregivers. Congratulations to all. Thank you.
Thank you, ma'am. Professor Himanshu Trivedi, sir, you are there? Sir, you are there?
Yeah. Yes, I will
Yes,
introduce
sir.
Himanshu Trivedi
Yes, sir.
because
Please.
he is from the start of my nursing career. We started the nursing career together. So it gives me an immense pleasure to introduce Mr. Himanshu Trivedi, who is a registered nurse and a midwife, and I have overall 16 years of experience. He has completed his UG degree from Anna Meenakshi College of Nursing, Coimbatore in the year 2005 and PG from Vinayaka Mission University, Salem in the year 2009. And he is a silver medalist from the Vinayaka Mission University in the Child Health Nursing Department. He has done a diploma in computer application. He is attached with many professional bodies, to be named few: TNAI, NTI, NHS, and NSS, of course. He has done certificate courses in intermittent fasting from Career Development College in London, published many papers in London in journals, resource persons, and state national conference. He is a very young, Himanshu is a very young, energetic. From the starting of this society, he was in the paperwork and all the administrative capabilities to handle the situations. He is a very worth in handling the peoples and has a good administrative skills. We are very
Yes,
proud
sir.
to have Himanshu in our founding members.
Yes, sir. Thank you, sir. Thank you. Dr. Santosh, sir, you are there, sir?
Okay,
Now
Muthu,
I
sir.
take. Yes, sir. I'll continue, sir. Not a problem. I'll continue. It gives me a immense pleasure to introduce our chairperson, special event, Dr. Santosh, sir. Area of specialized is MSc in pediatric nursing and MBA in hospital administration. Sir has completed. Moderate many
hospital administration.
Melvin, sir, please mute yourself. Moderate many conferences organized, participated in national and international conference workshops. He has published 15 plus research studies in national and international journals and is also an editorial board of many referred journals and a life member of many associations and organizations including NSS, NTI, IAMBSS, UJREC, PNNP, NFL, NFI, and INPAFNUS. He is also a governing body member of UP State Medical Faculty, Lucknow. Kuntala Shah, ma'am, you are there, I feel, ma'am.
Yes, sir.
Yeah, ma'am, please introduce yourself, ma'am, please.
Okay, thank you, sir. Good morning to all of you. Honorable Chairperson, Dr. Khanna ma'am, Honorable Chief Guest, Dr. Asia ma'am, Guest of Honors, Dr. Rajni ma'am, and Dr. Bimla Kapoor ma'am, all dignitaries and participants, and my NSS family members. Good morning and Jai Jagannath. This is a great day today, and I am with you all. First of all, thank you all for giving me this opportunity to introduce myself. Myself, Mrs. Kuntala Saha, belongs to the state of Odisha. I have my bachelor degree from Samalpur University and registered nurse and midwives from Odisha Nurses and Midwives Council. I have 33 years of nursing experience in ICU and various clinical setup. I retired since last year as DNH from IGH Cell Rourkela Steel Plant. Now I am an active member of Nursing Scholar Society and working with NSS. The aim of NSS is the care to the caregiver. I believe in hard work and self-motivation. My aim is to be a good and successful social worker. This is all about me. Last but not least, I would like to congratulate all the members of International Carnation Chapter 27 and wish you all the best. One more thing I would like to say, Nursing Scholar Society, the aim is to care to the caregiver, and myself is a bright example. Search for your vehicle on your device and select it once it is found. Nursing Scholar Society. Here I want to say that
when I joined Nursing Scholar Society. Since that day, I know about the care and caregiver. As you all know and see my profile, it is just only a line, but Nursing Scholar Society has given me to this position today. It is just only for NSS and Khanna ma'am's love, support and care to bring me up. I want to say this because if we can unite together and work, we must achieve what our chief guest says today, Dr. Asia ma'am. We can achieve my health and my right topic. Thank you all.
Yes, madam. Thank you. Thank you
Khanna
so
ma'am
much.
for your support. Thank you. Jai Jagannath.
Thank you, madam. Thank you.
Muthu sir, I will take
Yes, sir.
1 minute. I would
Yeah,
like
please,
to
sir.
add about Kuntala ma'am. She's our always keeping our records. Our records are safe only because of Kuntala madam's dedication and hard work. She has maintained all the records of our members. If any of the members digital, if they speak with us that our membership ID card is lost, and I can assure you, she is having very up-to-date records of all the members, including their phone numbers, email. So any members they lost their ID card, if they intimate us, I can assure you within 10-15 minutes we get the records. This is the ID number, and it is very easy for us to remake and reduplicate. So she is we give a very salute on behalf of all the executive committee. We are very safe and our records are very safe. It's only due to the dedication of Kuntala madam. Thank you, ma'am.
Wow, good, great.
I would
Really
like to
great,
say
ma'am.
something. Muthu sir,
Yes,
that
ma'am.
Yes, sir.
is our right hand. For
Yes, ma'am.
brochures, for certificates, you will get on time, like you will finish
Yes.
and the certificates are already there. And it is such a matter of feeling so proud of her. And long live Kuntala ji. We all are proud of you.
Thank you.
Really proud of you, ma'am.
It is my pleasure, ma'am.
Just want to say a word.
Thank
Yes,
you,
ma'am.
Kuntala,
Yes, Jans.
Kuntala,
Yes, ma'am.
you say that NSS has made you like that. Actually,
Yes.
you had all the potentials. It is only somebody had to find out those potentials which we were not able to do, and all those potentials of yours are now being seen as a leader. Congratulations, keep growing well.
Thank you, ma'am. This is all for your support.
Thank you, ma'am. Thank you so much.
Dinu sir will read Priyesh Jans.
Ma'am, now I call Dr. Alka Tajne, ma'am, to about a presentation by the students on realizing their rights to health in a world of turmoil. For this, I would like to call Dr. Alka Tajne, ma'am.
Again, good morning, everyone. Dr. Suresh Narula Khanna ma'am, Dr. Vimla Kapoor ma'am, and Dr. Asha Qureshi ma'am. With the blessing you all, while seeing your face, I am getting energetic every time. So I'll start my today's message, realizing the right to health in a world of turmoil. I'm requesting my both the student, Mr. R. MSc Nursing student. Akshay, please share a slide. Akshay, are you there?
Ma'am, you want to share the
Ma'am.
slide, ma'am?
Sir, please allow me to share the screen.
Yeah. Just a minute.
Mr.
Just a
Akshay
minute. Just a
Punjabi, share, sir.
Yes, madam. Just a minute. Yeah, you can
Yeah.
share it now.
We can see the slide, yeah.
Yes, madam. It's visible.
Okay. Yeah. Okay. As you know, this year theme is my health and my right, and this is one of the topic we have taken, that is realizing the right to health in the world of turmoil. Second slide, please. The right to health is universally recognized as a right, such as the Universal Declaration of Human Rights, that is UDHR, and the International Covenant on Economic, Social, and right is not just a call for access to healthcare, but a comprehensive guarantee for an environment that allows individuals to achieve and maintain a state of complete, which include armed conflict, potential instability, economic inequality, climate change, and social inequity, each of which present the significant challenges to realizing the right to health for all people, particularly the most vulnerable. Next, please. Next slide, please.
Yeah.
Mr. Akshay. Okay. In a world where turmoil is a constant, how can we ensure that the right to live reality? This essay explore the barriers, the interaction, the intersection of bodies in protecting and fulfilling this right, and the practical steps that can.
I think there is some
Steps can
internet
be
issue
taken to
problem.
address the challenges posed by turmoil. Yeah, that is the problem, ma'am. Okay.
Yeah.
So the foundation of right to health, the right of health as articulated in international human rights law, encompasses a wide range of elements according to the World Health Organization. The right to health includes access to timely, acceptable, and affordable healthcare, as well as the provision of basic public health and access to nutrition. The full realization of right to health involves addressing not just the healthcare infrastructure, but also the broader social determinants of health. That is economic, social, environmental factors that impact in an individual health outcome. Next, please. The UDHR adopted in 1948 laid the groundwork for the recognition of right to health, asserting that everyone has the right to standard of living adequate for their health and well-being. Article 25 of UDHR recognizes the right access to medical care, but also the social and environmental conditions necessary for good health. The ICESCR, which elaborate on the right to health by specifying the obligation of state parties to take steps to achieve progressively the full realization of the right to everyone to the enjoyment of the highest attainable standard of physical and mental health. Next slide, please. Next slide, please. Akshay, sir.
I think because of the internet problem, we are not able to hear the full message, you know.
Okay. The challenges of real established framework, the realization of the right to health remains severely hindered by turmoil in a various forms. In the 21st century, we face an interconnected web of crises that include conflict, economic instability, climate change, and the inequitable distribution of the resources. These crises intersect in complex ways, exacerbating the health disparities and further entering the inequality. Next slide. Okay. So coming to armed conflict and the political instability. So the armed conflict, civil wars, political instability are among the most acute threat to the right to health. Conflict disrupt the healthcare system, destroy the health infrastructure, and displace millions of people. In a countries affected by armed conflict, access to medical care becomes extremely difficult and entire population may be left without essential services such as maternal and child health care, vaccinations, and the mental health support. Next slide. Okay. So political instability, further understanding the effort to achieve universal coverage, that is USC, in politically unstable countries. So where governance is a weak, the allocation of resources may be ineffective and the political elites may depolarize health in favor of other needs, such as the military expenditure. In extreme cases, the government may actively prevent the access to healthcare for a specific group such as political dissident or uh, marginalized communities in a violation of the international human rights law. Next. Next, please. Okay. So coming to economic inequality.
Alkaji, can we go to
Inequality
the
and the health disparity
conclusion?
in determining a health outcome and
Can we go to the conclusion and ask the
Yes, ma'am.
students to present? Because
Okay.
thank you.
Yes, ma'am. Yes, ma'am. So the strategies for this problem will be dealt with Mr. Akshay Panchal. Sir, you can read fastly because the time is. Okay. Mr. Akshay, you can start.
Thank you, ma'am.
Ma'am, is it visible, ma'am?
May I audible, sir?
Yeah, please go ahead. Go ahead.
Yes.
Okay, so my good morning, all the respected dignitaries. My topic is strategies for realizing the right to health. As while the challenges are significant, there are pathways forward in the pursuit of realizing the right to health for all. Several strategies can be adopted by the government, international organizations, and the civil society to address the multifaceted challenges by the tomorrow. The first strategy is strengthening the health system and ensuring the universal health coverage. A resilient health system is the foundation for realizing the right to health. Government must prioritize public health infrastructure, ensuring that all the citizens, regardless of their socioeconomical status or the geographical location, can access the essential health services. The universal health coverage is the critical component of this, ensuring that everyone has access to the health services they need without experiencing financial hardship. Building the resilient health system requires the investment in the healthcare, workforce training, the provision of essential medicines, and the establishment of robust emergency response mechanisms. The health system must also inclusive and sensitive to need of vulnerable populations such as women, children, and the people with disabilities. So, what are the steps taken at global level to strengthening the health system and ensuring universal health coverage? In that, first, the World Health Organization, that is WHO, plays a central role in the shaping the global health policies and promoting universal health coverage through the framework like a Universal Health Coverage 2030 Partnership. Global cooperation is needed to ensuring that health system to emerging health crises such as pandemic. And second is financing health system. There is need to be increased global investment in the health infrastructure, human resources, and the health technology. The donor countries and international organizations like World Bank and Global Fund contribute to financing health system in the lower income countries. Then third is capacity building and knowledge sharing. Collaboration among the countries for knowledge exchange and technical assistance can help to improve the capacity of health system in low and middle income countries. The countries can adopt the best practices from others in the term of governance, health delivery, and the cost-effective solutions to improve the health outcomes. And next is strengthening the primary health care. A strong primary health care system is the backbone of universal health coverage globally. There is emphasis on strengthening primary health care to provide essential service close to community they serve. The Astana Declaration 2018 emphasized the need for primary health care to be affordable, accessible, and sustainable, particularly in low resources settings. So the second strategy is addressing the social determinants of health. Effort to be realized, the right to health must go beyond healthcare services to address the underlying social determinants of health, including education, income, housing, and the environment. Government must adopt policies that tackle the poverty and inequality while promoting social inclusion and equality. This policy should ensure that all the people have access to clean water, nutritious food, and safe housing and quality education. That all are the key elements that influence the health outcome. Public health intervention must target the most marginalized and disadvantaged population, ensuring that no one is left behind. Health disparities based on the race, gender, ethnicity, and disability must be eliminated through the affirmative action, anti-discrimination policies, and inclusive healthcare practices. So at global level, the WHO Commission on the Social Determinants of Health, the 2008 report from the CSDH highlighted the importance of addressing social determinants of health to reduce the health inequalities. It urged the global stakeholders to adopt the whole of government and whole of society approach to address social determinants of health through policy changes, including education, employment, social protection, and environmental factors. These all are the sustainable developmental goals that is given by the WHO. And global health initiatives. The various international organizations such as WHO, then UNDP, are working together addressing social determinants of health globally, particularly in the lower and middle income countries. And the third strategy is international cooperation and the global solidarity. The global nature of the health challenges demand the international cooperation. The global health governance led by the organization like the World Health Organization must be strengthened to ensure effective response to health crises and equitable distribution of health resources. The international cooperation is also crucial in addressing the social, economical, and the environmental factors that shape health outcomes. During the global crises such as pandemic, international solidarity is essential. While their nation must support the low and middle income countries by ensuring equitable access to vaccines, medical treatment, and essential supplies. Countries must collaborate on the research and innovation to address the global health challenges, including climate changes and emerging diseases. So at a global level, first, ultimated United Nations and the multilateralism. The
Akshayji,
United
one
Nations.
submission. Is it come to conclusion?
Yes, sir. This is the last slide.
Yeah, please.
And the conclusion is done by my colleague.
Sure, thank you.
Okay. So at United Nations, the United Nations is the cornerstone of the global corporation promoting peace, security, human rights, and the WHO, UNDP, and the UNICEF play the critical role in the coordinating effort for the global health, poverty reduction, and education. So now I invite my colleague Mr. Chaitanya Kadam for continue this presentation. Over to you, sir.
Good morning to one and all. Good evening to one and all. Thank you, sir, for introducing me. It's my privilege to speaking over such a big dignities of my own profession. So, according to my topic, advocacy and accountability. Am I audible, sir?
Yes, only 3 minutes.
You are audible.
Yeah, yes, ma'am. Advocacy and accountability. Civil societies play a key role in ensuring that the right to the health is upheld. Advocacy organization, community group, and health rights defenders must hold government accountable for their obligations under the international law to protect the fulfill to the right of the health. Next slide, sir. Hello, Akshay sir, next slide, please. Okay, please go to the next slide. Okay, so challenges to the global advocacy and accountability. The dispute efforts in implement advocacy and accountability globally, there are significant challenges. The first challenge is the political will. In many countries, political leaders and the institutions may reluctant to implement accountability measures or allow advocacy to thrive, especially if they threaten their power. Then the corruption. So in corruption, the corruption remains a major obstacle to accountability in many parts of the world. Government or institution may lack the political will to address corruption, and even anti-corruption bodies can themselves be compromised. Next slide, please. Then the another point was weak rule of the law. In many countries, legal framework are undeveloped or not enforced, allowing public officials and the institution to evade accountability. Court may be manipulated or law may not be strong enough to hold power of the account. Then the another point is access to information. Even in the democracies, accountability, government may restrict the flow of the information either through censorship or a lack of a transparency. Next slide, please. So the steps the world can take to strengthening advocacy and accountability. The first point was the strengthening international framework. International bodies like the UN and regional organization can continue to develop strong legal frame for the health rights, anti-corruption, and a democratic governance. Countries should be held to account through universal periodic review, international courts, and a trade agreements. The another one is supporting civil society. Global partnership and the funding should be provided to the support civil societies organization that advocate for the rights of the marginalized group. Environmental sustainability and the social justice, empowering grassroots movement to key to make a lasting changes. Next slide, please. Next slide, please, sir. Hello, Akshay sir. Next slide, please. Hello. Okay. Then expanding digital transparency, government and international organization can use digital platform to make sure action and a decision more transparent. Digital tools can allow citizens to monitor spendings, track government permissions, or report abuse. From the next point is promoting good governance and a legal informs. Countries should adopt and strengthen policies to protect good governance ensure that the public officials are held accountable through independent agencies, strong judicial system, and open data initiatives. Global collaboration. The country need to collaborate more effectively to address cross-border issues like climate changes, human trafficking, tax evasion, and terrorism. Global corruption, support by the international law and share values is an essential for ensuring the global advocacy, accountability, and the mechanism of the effect. Next slide, please.
Chaitanya ji, still it is
Yes, sir.
there, or you just come to the
Sir,
conclusion, please?
Yes, sir. Sir, it is the last point. That is the global.
Please. Yeah.
I will take. Sir, please
Yeah,
go
come to
to
the
the
conclusion.
previous. Okay, so in conclusion, realizing the right to health. Okay, then sir, please give me five minutes for
Right,
last.
Chaitanya ji, because we need to
Actually, we are
induct so
getting
many,
too late, you
running out of
Okay.
We
time
have
actually.
to,
You
I
need,
think
you
we
need to
can do
come to
the,
the conclusion.
we
Okay,
can
okay.
do the induction first,
Yeah.
awardee
Yes, sir.
first, and then later on we can continue because some of the people in USA has to go for work
They're
in the
all,
morning.
they're all from across the globe. We should think of that, right?
Oh, yes, sir. So, in conclusion, realizing the right to the health in a world marked of turmoil is a monumental challenges, but it is not an impossible one. It requires political will, strong governance, international collaboration, and the commitment to equity and the justice. The barrier range for the armed conflict and the economic inequality to 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 climate change and a pandemics are the significant, but they can be overcome through a comprehensive multi-fact strategies to address both the immediate need of the population and the system cause of the health inequities. By the investing in the health system, addressing social determinants of the health, and promoting global solidarity, we are sure that the right of the health is a universal reality and not just a lofi ideas. Thank you, ma'am, for listening me.
Thank you, Alkaji and the Chaitanya and one more Akshay. Thank you so much.
Thank you, sir.
Akshay, you just exit, huh? Yeah, thank you.
I think it will take so many presentations a day. I think people are getting, they have to go for work in the morning. So I think we need to be little, we can do the induction ceremony first, introduce the inductee members, and then we can continue.
Khanna ma'am. Yes, Asha ma'am. Khanna ma'am.
Otherwise, international members will leave and there is no point of inducting them.
No, that's finished, ma'am. Now introduction of.
I will read.
Yes, sir.
Khanna ma'am, you are there? Khanna ma'am?
Khanna ma'am?
I think madam is muted.
Just a minute, sir.
We can continue by that.
Yeah, madam is there, but she is muted, I
Ma'am.
think. Madam, unmute yourself, please. Madam Khanna, you please unmute yourself.
I did.
Yes, ma'am.
Yeah.
I'm typing that. Go to induction first, please.
Yeah.
Yes, ma'am.
Hello. It is clear?
Yes. Yeah, ma'am. Just a minute, ma'am.
Let me apologize to Prerna ji.
Yes. No problem, madam.
Now I take this opportunity to call our beloved patron ma'am, Dr. Khanna ma'am, to introduce our today's international chapter, current chapter 27, executive members. Over to you, ma'am.
Okay, we can skip that also. Go to induction part.
Yes, madam.
Please.
Introduction of Vice President, ma'am.
Go to induction part. Induction part.
Yes, madam. Yes.
Yeah.
It starts from Navkiran Kaur. Yeah.
Yes, madam.
Go to that and we can come back again. Okay,
Yes, ma'am.
here. Today we have a benevolent ideas, and also in practical, we are going to do that. Hall of Fame inductees list is Mrs. Usha Rai, Mrs. Navkiran Kaur, Mrs. Vasantha Kumari, Mrs. Mary Parambil, and also in addition, we are proud to have our Mrs. Usha Rai nominated and going to be having a Lifetime Achievement Award certificate. In those inductions, these are the members from 27th chapter of Carnation. We are so proud these people just upgraded if they were in lifetime or general members, or some joined it new. So I'm so thankful to each one of that. So I will invite Binu sir to first read the Hall of Fame and then Society Oath, and then a few words about lifetime achievement.
Next slide, sir.
Yes, sir.
Yes. I, Binujo, solemnly pledge as an inductee of the Hall of Fame of Nursing Scholar Society that I will honor and cherish the valuable award by showing my elegance to this society. I will uphold the standards of nursing profession, strive to promote and project the positive image of nursing profession. I will keep my elegance to the society and fulfill my duties as life member of this prestigious team. I pledge in front of Almighty to promote and perform my duties as assigned. I request all the members to say I do.
I do.
I
do.
Okay,
I
Binu,
do.
let me read quickly the new members. So you will read oath, society oath first.
Yes.
We have about 27 members who joined us, Tanya, because they are have to be in induction in society. Tanya Sharma, Kolanidi, Manjusha, Saritha, Deepak K, Mr. Balaji, Bhanudas, Prasanna Deshpande, Mrs. Vasudha, NS, Professor Kavitha ji, Dr. Santosh Kumar, Dr. Prerna ji, Dr. Smriti Solomon, Mrs. Navkiran Kaur, Mrs. Usha Rai, Mrs. Mary Parambil, Professor Kuntal Mandal, Nagdia Sonal, Methapara ji, Sudina ji, Lakshmi, Jalela ji, Dhruti, Maria ji, Valamor, Rupal Parmar, Mrs. Neelam, Kancharia ji, and Sudawala ji. These are the members will be inducted in society also. And just to let you know, Samriti Solomonji and Prerna ji is also inducted in Hall of Fame because Prerna ji is Vice President of Begonia Chapter 9 of MP, and Smriti ji is a secretary for that. So kudos to all of them who are inducted in Hall of Fame. So please read the society pledge.
Yes. I, Vinujo, solemnly pledge my allegiance to the society that I will be abiding by the rules and regulations of this honorable society. I will discharge my duties and bear the responsibilities as an office bearer. I will carry on my responsibilities as a life member. I will be a responsible member and not to give any statements to media or in any groups which will reflect negatively on the society. I will function as a part of the society and not solo to promote my agenda or business. I pledge in front of Almighty and this general body to uphold the nursing professional standards and project the honorable image of my profession. I do.
I do.
I do. I do.
I do.
Congratulations to
I
all
do.
of the inductees.
Thank
Go to
you, Binu sir,
Prerna
and
ji. Yeah, go to Prerna ji.
thank you, Binu sir and Khanna ma'am.
Oh, there is something more. Oh, yes, important. The most important. 5 of them. Please let us finish that too.
Yes, madam, I have added.
Who is going to announce? Binu sir, you are going to announce, or I should announce you actually. I am so
You,
announce our World Men's Days, 5 selected executives, foundation members, or some are chapter presidents and some are national presidents, and they are being selected to be honored and felicitated for this year's 2024's World Men's Day. And they are our Professor Dr. Binuji and Professor N.S. Simonji. Simon, sir, are you there? He was in the church and he said he's coming, but I didn't see him. Okay, Mr. Sandeep Karavasaraji and Priyesh Jainji and Shri Rajkumarji. Our 5 stalwarts are felicitated today and we congratulate them. If anyone would like to say anything?
Yes, all these 5 men deserve this felicitation today, as they were the backbone of our society and they are doing very hard work, and I really appreciate, they deserve much more than this even. They are so hardworking.
That's true. That's true. Okay, are you going to Prernaji's lecture, please? 10 minutes.
Yeah.
She will finish quickly.
Yeah.
Okay.
Yeah, madam.
Yeah, just I'll go through.
Start the slide.
Just a minute, ma'am. Just I'll introduce this thing and I'll go through.
After that.
Just a minute.
Let him say a few words about you.
Introduction of today's speaker, Dr. Prerna Pandey, ma'am. Madam will be speaking on strategic leadership in healthcare today. Madam is working presently as a dean and principal of Institute SAIM's College of Nursing, Indore, MP. Madam has completed her BSN, MSN with a specialty of child health nursing and PhD nursing from pediatric. About professional experience, worked as various reputed hospitals and educational institutes. Other activities include participated and presented paper in many national and international conferences and workshops, as well as published papers in many national and international journals. Attended international conference as expert speaker, attended international conference as expert speaker, attended national conference on research methodology, current research trends in nursing as a speaker, conducted PhD viva at various universities as an external expert, expert examiner and invigilator for UG, PG programs under Medical Science University and other private university, two awards, two achievements. Received award in IMNCI, Delhi, received certificate of TOT, received certificate of education technology membership at Association President at Indore, TNI member at National Teacher Association of India. Over to you, ma'am.
Thank you. Thank you, sir. Thank you so much that I am presenting there. It is clear? It is audible?
Yes, ma'am. Yes, ma'am.
So first of all, we have to start my topic. That is already, you have already given the topic strategy for the transformational leadership. So that we have to start the transformational leadership style, inspire employees to strive beyond required expectation to work towards a shared vision, whereas the translational leadership focus more on the extrinsic motivation for the performance of specific job tasks. Learning to balance this style can help leaders reach their full potential. Next one, what is the transformative leadership? So first of all, we will see that there are 3 types of the transformation: transformative, transformational, and transactional. So first we will see what is the meaning of transformative. It means the leadership. Please before slides. Please, sir.
Yes, ma'am. This is it. Is this?
One more, sir.
Yes, ma'am. This one.
Before.
This one, ma'am.
Before, sir.
No, this is the only one, ma'am.
Only one. Oh, yes, sir. That good. Yes, yes. Yeah. Transformational and transactional. There are 3 types of the leadership. After that, we will go there. And that. Yes, sir. Sir, starting that is so many slides are there. Yes. There are so many slides before one, sir. That is 4 eyes of there, sir, before one. I have 20 slides there.
Ma'am, as per whatever you have shared, say that only I have added, ma'am.
Yeah, there is no problem. Yes, we have to start now. Yes. Sir, there are 4 eyes. 4 eyes of the translation. Oh my.
The screen that is on the screen.
Ma'am, you can share your screen, ma'am. If possible, if it is not there, means you can share your screen, ma'am.
Yeah. That is already there is the leadership strategy of the healthcare. It means there are so many things are there. First, we will see the transformational leadership by the CEO. Second thing, promote interdisciplinary collaboration. Next one, leading by the sir. Where it is? Slide. Sir, where it is slides? Yeah. I already sent you.
This time.
It is no problem, sir. Please display this one. Excuse me?
Yes, ma'am.
Yes. Yeah.
Is that right, ma'am?
Yeah.
Okay.
Yes. Before.
Okay.
Yes. Strategic leadership involves identify the vision, mission, value, and goals for your organization. Strategic leadership addresses health system design as well as delivery and evaluation. Next slide. Next, sir. Yes, there are so many things. Strategic healthcare, it is the leadership. First one, we will see the transformational leadership by the CEO. Second thing, promote interdisciplinary collaboration. Next one, leading by the example. Next one, cultivating of the culture of living, learning, focus on the patient-centric care, and that last one, empathetic leadership approach. There are so many things during the related to the healthcare. Next one, transformational leadership healthcare. It is very important topic that transformational leadership inspire and motivates healthcare professionals to achieve their fullest potential, enhancing overall organizational performance. Next, key characteristics include vision, inspiration, and ability to foster changes, critical for developing a positive healthcare environment. Next, the importance of the transnational leadership lies in its ability to drive changes, improve employees' engagement, and ultimately enhance patient outcome. Next, there are 5 C's. 5 C's for the transformational leadership. What is meaning of the 5? First one, clarity. It should be maintained our clarity, confidence, connection, commitment, and creativity. The first one we will see what is the meaning of the clarity. We should have the maintain vision, value, realistic optimism, and research, knowledge, and transparency. It should be maintain our clarity. Next, confidence. How to do the confidence? We had to trust our staff. We had to trust and faith to our team, and we had to faith in our partner, capabilities, skill, wisdom, and trust. We should be maintained. Connection, why we had to maintain the connection, inclusion, the colleagues, alignment, empathy, compassion. We had to maintain the connection with the others. Creativity, we had to do the research, innovation, lateral thinking, system thinking, diversity of the thought, risk-taking, continuous improvement, and commitment. First of all, we had to commit to the others. Why it is? Because of we are leader. Purpose, people, principle, and performance. There are 4 P. Next one. Next slide. Yes. Component of the, no sir, component of the transformational leadership. Before one, yes, component. There are 4 components. First, intellectual stimulation. Second, inspirational motivation. Third one, individual consideration. Last one, intellectual stimulation. What is the meaning of the intellectual? Intellectual means intellectual stimulation, all about the encouraging innovation and the creativity of our team. Second, inspirational, we have to inspire to and motivate to the second of the key of the transformational leadership mix, means team and other people and all that. Individualization consideration, highlighting the importance of the giving personal attention to each team member's need for the growth and achievement. Last one, intellectual stimulation. It is all about the leading. By the example, it's about embody of the values and principles that your organization stands for. Next slide. Key. What is the meaning of the key strategy for the effective transformational leadership? First, we will see the create of the communicator vision. Second, model ideal behavior. So first, we have to create our communication vision. Develop a compelling, a clear vision that align with our organization goals. Second thing, communicate the vision consistently, passionately in the inspire commitment. Tailor the vision to resonate with the team member values and aspiration. Model ideal behavior. Lead by the example. Why we have to maintain the model ideal behavior? First, we have to maintain effective transformational leadership vision. Second, this thing is the ideal behavior. Demonstrate integrity, accountability, and ethical decision making. Second, show dedication, hard work, and the realizing of the inspire of the team. Next, be approachable of the open to feedback, modeling, and this. Third one, sir, next. Third one, foster visualization development. Act as a mentor or coach by recognizing and nurturing individual potential. Provide opportunities to learning, upskilling, and career growth. Empower team member to take initiative and honor of the task. Next one, fourth one, encourage innovation and creativity. Everything we had no, every situation, we had to creativity and innovation, we had to do. Promote a culture of the experiment or open-mindedness, encourage team members to share ideas, challenge of the status quo. Provide a safe environment to calculated risk-taking and learning from the mistakes. Next, fifth one, build.
Can you come to the conclusion, please?
Yes.
Thank you, Prerna.
Fifth one, strong relationship interest, inspire motivation and commitment. Seventh, promote collaboration and teamwork. Next, adopt and be flexible. And last one, and that transformational leadership, what is the quality? It should be authentic, passionate, honest, attentive, supportive, charismatic, and adaptive. It should be 7 characteristics of the transformational leader. Yes. Leadership strategies including building trust, encouraging others, encouraging innovation thinking, creating a positive work culture, and the individualization. Everything that is over. And impact, that is the last point of the impact. Transformational, last point, madam, it is. What is the impact of transformational leadership? Transformational leader create a positive work environment. We have to create promote communication, encourage innovation, creativity, supportive, empowering, encourage their followers to the take risk and challenge of the status. Sir, slide.
Yes, madam. I have moved it.
Impact, everything we have already going that. This is done, sir. That is last. Yeah.
Last slide. Okay, ma'am.
Thank you.
Yes.
Thank you, ma'am. Thank you.
I think if we forward the PPT to everyone can read all those leadership and all, instead of making so much,
Thank so
in
many
this forum.
already missing. That's why. Thank you so much. You have already given the opportunity for the present as a speaker. Thank you. And we will see.
Thank you, ma'am.
Thank you
now
so much.
I call Dr. Khanna ma'am to introduce our Vice President, Mr. Navkiran Kaur ma'am.
It is my pleasure to introduce our international executives who are being first inducted, and now I'm giving about their profiles. Navkiran Madam is in Carnation 27 International Chapter's Vice President and a nurse entrepreneur having her private business for profit. She completed her MSc in nursing from Chandigarh in India and worked as an RN and nursing tutor there before moving to Canada after marriage. Her business mind combined with passion of guiding nurses brought her at the juncture to open her own private coaching company where she also conducts NCLEX and other exam courses. She has joined our non-profit Nursing Scholars Society to enhance our mission, which is care of the caregiver, by collaborating and sponsoring some conferences via her private company. We are thrilled to have Madam in a 10-star President's Circle and are sure that we will be mutually benefited as our students and other members who are planning to come abroad will be able to have an access to her coaching. Welcome, Madam Navkiranji. Next. Is Navkiran there if she wants to say a word or two?
Yes, ma'am, I'm there. Unfortunately, my throat is very bad today. That's why, yeah, thank you so much for welcoming. Yeah. I don't know, suddenly something happened this evening and I'm not able to talk. Thank you so much, ma'am, for the introduction that you have given about
Now,
me.
Kiran, you can unmute your video at least. We can see you.
Yes, ma'am. Actually, I'm from last 1 week, I'm so sick. I was in the hospital, ma'am. That's why I was just trying to kind of, contact with you. I'm so sorry. I have a so bad throat today.
Still melodious voice. Say it.
Thank you so much, ma'am. Dr. Sue Khanna, it is so nice to see you, and it is so nice to see all the other members here. And thank you so much for introducing me in this meeting. There are so many scholar people sitting here, and I'm just nothing in front of all of you. You have kind of, sacrificed your whole lives to this career. And I know I will learn a lot from all of you. And seriously, thank you so much for considering me as a vice president. And I will definitely, I will try to meet up to your expectations. Like I will definitely try to make this society very, very popular at all world level. Thank you so much, ma'am. Thank you.
Wonderful.
Thank you, Navkiran.
Thank you. Next.
I think the president also wants to give her feedback, some views of hers. She should be invited.
Who?
Yeah.
Who, madam?
Yeah, Yeah, President Usha also wants to give her views before leaving.
Oh,
She
Vice
wants to
President,
talk. Yeah, yeah.
where is, before she goes to sleep, where is Usha ji? Wants to say something? Is she coming back?
Usha madam, you are muted. You can on the microphone is muted, Usha.
Okay, in the
Yeah,
meantime,
she wrote that she wants to talk. She wants to give her views. Where she has gone.
when she comes, we will accommodate her.
Okay.
Introduction of Secretary, Miss Molly Sam. She has her MSc degree in nursing with psychiatric nursing from 91 to 93. She worked as nursing director, professor of colleges in India and in USA also as a registered nurse and nurse educator. She is publishing a journal, Nurses of India, and it is since 24 years that she has been doing it, and she is a chief editor for her magazine. And we welcome her as a secretary of our Carnation chapter. Next is, I don't think
Madam
Molly
is
is
there.
there.
No,
Molly?
madam is there, ma'am. Madam is there.
Okay. Molly, want to say a word or two?
Yeah,
Hi.
Molly is here, I think.
How are you? Yes, madam. Good. Nice to see you all. And it's a pleasure. I think I'll start working towards the goals you have put forward. Let's see. And from here, we can take over some things. Like I said, publicity, communication, everything should be important. The way we do things, how do we attract people is very important. Not that we drive away with too much of information. To simplify informations to an extent, it reaches everybody.
Yeah.
And water it down. We cannot give thick milk to a child. It will vomit. So let's start giving it as thin, small solutions, little solutions, so that they can imbibe it and understand it and then take over. It's important. If we do not do that, it becomes a very boring kind of lectures only from our side.
Yeah.
It's very important. Let's put it that way. That's what I would like to say. Make your communication important in such a way that everybody, we are talking about staff nurses. A person bedside, where is a single bedside nurse here now? That's what we have to go for. Thank you.
Okay, next time we will try that. Next is introduction of Treasurer Prachi Saniji. Prachi Sani is postgraduate nurse in community health nursing and have worked in AIMS, New Delhi for 4 years. She is currently permanent resident in Canada and gained CPR level certificate. She has published research studies on Ayushman Bharat. She has participated and presented in many conferences at local, state, national, and international levels. Reviewed many nursing textbooks. She is associated with St. John Ambulance and she is ACLS also and provider, RLS provider and AHA. We welcome her also, but she is our old pro, like a founding member from National. She was with us as a mass media coordinator and now she's with the Carnation chapter. We welcome her. I don't think she joined from India at the moment. She is in India. Is Prachi there? Okay,
No,
next.
I don't think she's there.
Acha ji. Next. This is our Dr. Pratibha Chandekar ji, and she is bylaws chair and holds a BSc, MSc, and PhD nursing. She has over 30 years of experience working as a staff nurse, PHN, sister tutor, and professor cum principal. Pratibha ji has been a resource person, chairperson, organizer for various workshops and conferences, at regional, national, and international level. She won the first prize for her paper presentation at the International Conference on Transformation in Health Science in 2023. She has authored 26 publications, including books and chapters on dyslexia, nursing practice, and research. She was the principal investigator for a state-level project evaluating community-based health services under NRHM in Maharashtra. Pratibhaji has 2 copyrighted self-instructional manuals for child healthcare and New Life Hope 2022. She worked as a technical consultant for the Swedish International Development Agency 2006 to 2010 and developed health resources materials. She has visited universities in Dubai, Sweden, Vietnam, USA, Israel, Egypt, and Jordan. Pratibhaji is a lifetime member of various professional organizations, including TNAI, NRSI, SOMI, AAMR, HI, CMAI, NSS, and Sochni. She has received multiple recognitions, including the Best Employee Award from KEM Hospital in 2001 and the Lifetime Achievement Award from Nurses of India 2022. Is Pratibhaji there? Okay, welcome to Carnation chapter. Next is our committee, peer review committee chair, Dr. Rajni. We have heard about her profile and she is welcome to our Carnation and she plans to open a chapter in Houston, Texas. Maybe someday. We both are saying to her, open another chapter, but we bet her with opening the Carnation chapter in Connecticut headquarters. Next. Tuti Madam is our again chapter with the Quincy and Bipin sir and in working with them. And she's now here in Canada and is a NSS special event chairperson. Stuti has professional profile and accomplished registered nurse practitioner with over 8 years of experience inspiring future nurses across diverse disciplines. Educational excellence earned an undergraduate degree from CM Patel College of Nursing, Gandhinagar, Gujarat, followed by a postgraduate diploma in palliative care nursing from Niagara, Ontario. Currently enhancing expertise in coronary care nursing in Toronto. Academic leadership, served as a dedicated faculty member and coordinator at Shah Jahanand College of Nursing from 2015, contributing to the development of future healthcare professionals. Examiner expertise, contributed as both internal and external examiner for the Gujarat Nursing Council and Gujarat University, elevating academic standards. Professional engagement, actively engaged with esteemed organizations such as NSS, NTAI, and the National CPR Foundation to advance nursing practice and education. She has certifications, certified in advanced cardiac life support, ACLS, psychology of old age, and patient-centric care. In global advocacy, represented the nursing profession through insightful educational visits to renowned healthcare institutions in the UK and Australia. She is deeply committed to volunteering, supporting orphans, individuals with disabilities, and elderly care to enrich lives and communities. We welcome Stuti. And is Stuti there to say a few words?
Hello.
Hello.
Thank you very much, ma'am, for this wonderful introduction. And I'm looking forward to work with this international chapter and from my end, all the very best to NSS team.
And she is a part of PPT developing and has now flew and with, oh, you are on. Good to see you, but take care.
Thank you, ma'am. Yeah.
Welcome to Carnation chapter. Okay. Next is Introduction of Chairperson, Research Committee, Professor Dr. Anjalichi Muthukumaran, ma'am. Professor Anjaliji last time also presented a paper, very accommodating and flexible person, and it is fun to work with her. Madam have done short courses in NA, BH, BLS, ACLS, PALS, pain management, blood pressures, first aid, and many more. She is a member of various committees and a chairperson of some, in addition to the role of observer, evaluator, inspector, resource person. So she has attended and participated in workshops and organized conferences at level and national level and international level. Then Asia's biggest fest and conference icon of Asia powered Siksha Ratan Samman Award. She has got many, many other awards also. Her research articles are published in referee journals and has been contributing to nursing profession throughout Punjab Nursing Council also. She is member of UIJIR and CNRS, International Researchers, NSS, INSC, TNI, NRSI, SOCHNI, SOMI, IRCS, IAF. Is Anjalicha there?
Yes, ma'am. I'm there, ma'am.
Okay, say a few words.
Yes, ma'am. Yes, ma'am. Confidence is something you create within yourself. It begins by believing in who you are. Based on this, happy morning to all dignitaries and chief guests, and for NSS president, founder and president, and Carnation chapter presidents, ma'am, and all organizing committee, giving me this opportunity and chance as a chair research committee, ma'am. Whatever the expectation of Narala ma'am, I'll surely do, and I'll plan to start. I just created all the members of one new chapter to start in UP again. So I was created. I'll get it this, and your expectation surely I'll do, ma'am. So very thankful for this, making us also and meeting all without any cost, just for connecting with advanced technology. Really, we are sitting in our place, and we also everybody, and we got your knowledge, your skills, your experience, all the eminent persons sharing with us. And two presenters also very nicely they presented all the things. It's very useful, ma'am. It's very informative for the society, and making three generation of people to come up with the how we can bring nursing standard to the society. It's amazing, ma'am. Amazing work. Really, we thankful to Nursing Scholar Society giving me chance, ma'am. Thank you, ma'am. I'll do your expectation, whatever you expect with us, ma'am. Thank you, ma'am.
You will be a contributor to the international, our
Sure,
chapter.
ma'am.
Next is Professor Dr. Vasanta Kumari ji. And she is a professor and principal at Shri Bhumika Nursing College with 24 years of experience, PhD in nursing from Rajiv Gandhi University of Health Sciences, MSc in nursing from Omayal Achi College, awarded Outstanding Teacher Award 2022 and Lifetime Achievement Award from Dr. APJ Abdul Kalam 2021, authored 60 plus publications, 3 patents, and managed 45 funded research projects, delivered keynote speeches at 63 seminars, and organized 40 plus educational events. Editorial board member for multiple international journals, life member of TNAI, SOMI, and National Neonatal Forum. Initiated MOU with the Volega University, Ethiopia, and Galgotius University in India. Welcome, Vasanta ji. If you are there, you would like to say a few words? Is Vasanta there?
I think not, ma'am.
No. Okay, next, moving on of Chairperson, Cultural Education Committee, Mrs. Ruma Bhattacharjee. She is such a plus. The day she joined, she was with the Bihar, and we reinvented or survived that chapter, and she was there to help us with PPT, with everything. At the moment, she is, I think, in Singapore. But if she is there, I will ask her to say a few words. Chairperson of various committees, Cultural Education, Mrs. Ruma Bhattacharjee, has 11 plus years of professional experience in a variety of settings. After obtaining her MSc nursing degree specializing in medical surgical nursing. She is life member in TNAI, Ministry of Health, UAE, AFOCN, SOCN, and NSS. She has extensively published articles and quasi-experimental study in referred journals. She has participated and organized many workshops and conferences. She is appointed as chairperson of Cultural Education Committee in Lily, as well as in our this Carnation chapter of International. Is Ruma there?
Yes, ma'am.
Yes,
Madam is
ma'am.
there.
Yes, ma'am.
Okay, we would like to hear a few words from you.
Thank you, ma'am. Thank you for giving such a lovely introduction. And I'm truly humble to be the part of this society, because after coming to this society, I came to know many of them, which I read their books and all this. And now I am seeing them, though I am seeing them digitally, but still I am seeing them. And if I want, I can talk to them. So thank you, ma'am, and thank you, sir, for giving me this opportunity. Now I don't need this one that I have to approach, how I will talk, how I will go. I can talk to them directly, message them. Thank you, ma'am. Thank you. It is so nice.
Thank you. Thank you, Ruma. Introduction of Mass Media Coordinator, Ms. Mary V. Parambel. She is a registered nurse with 18 years of critical care and nursing education experience, holds a BSc in nursing from Mahatma Gandhi University, Kottayam, worked across India, USA, Saudi Arabia, and Canada in diverse healthcare roles, served as nursing tutor, Himalayan Institute, and assistant lecturer, Caritas College. Critical care nurse in the USA, emergency nurse in Saudi Arabia, clinical instructor at Fortis Jaipur, currently a critical care RN in Canada, delivering high quality patient care, president of RNAO Quinty chapter, advocating for nursing and promoting best practices, certified in critical and coronary care, Durham College. Is Mary there? Mary?
I think she's not there, ma'am.
Okay, next.
Ma'am, thank you. Thank you so much, ma'am, for
Okay,
introduction of.
wait, Muttu sir. There were
Yes,
5 felicitated World Men's Day people, and there is that Sandeep sir who wants to say on behalf of them a few words. Please unmute him, Sandeep sir. Is Sandeep sir there?
he is there, ma'am. He's there actually. He joined.
He said last time you didn't unmute, and now he wants you to unmute him.
Yeah, just a minute, ma'am.
Just 1 or 2 words, then we will
No,
go
he's
to.
not there, ma'am. He's not there.
He's there. Oppo.
He's there, he's there, sir.
Sandeep.
Oppo.
Sandeep sir, at least video
His
on
name,
Corona.
profile name is Oppo. Video is on.
He's there. He's there. He's there. Sandeep sir, asked unmute करो ना, बात करो ना. संदीप सर, हम आपसे बात कर रहे हैं.
I don't think he is here.
He's there, ma'am. He's there. He's there. He's there. He's there.
सर, संदीप सर, अनम्यूट कीजिए अपने को. सुनाई नहीं दे रहा है.
See, Ruma came for his chapter presidents.
Yes, madam. Really, really.
I found this on the web.
संदीप सर, unmute करो ना.
सर कुछ तो आप बोल रहे हो, हमें सुनाई नहीं दे रहा है. प्लीज अनम्यूट
Unmute, unmute, unmute.
Unmute, yes.
ये ईयरफोन हटा दो सर, ईयरफोन हटा दो, सुनाई देगा आपको. हटा दो. लिसन टू माय एक्शंस. हाँ, इसको हटा दो. अब आवाज म्यूट करो, अनम्यूट करो.
Unmute करो.
He requested me that you unmute him.
इसको निकाल दो. वो जो
unmute करो.
वो जो हेडफोन है ना, वो लैपटॉप से निकाल दो सर, तो आपको सुनाई देगा. लैपटॉप से उसका वायर निकाल दो. अब उसको अनम्यूट कर दो. आप नहीं हो रहा. He's trying his best, I think, but
Yeah.
Okay.
The red sign will be, oh, just touch that,
Yes,
Unmute.
madam.
Yeah.
Please go to Meena ji for 3 minutes for her laughing.
Okay.
He can change our mood. Go to Meena ji.
Yeah.
Thank you, Kanna ma'am, for
You're
introduction of international chapter.
You're
Now I
welcome.
take this opportunity to call our keynote speaker, Ms. Meena Patola ma'am, a dedicated nursing professional with 37 years of experience in clinical education and administration, proven leadership skills with expertise in nursing education, nutrition, and patient care. Passionate about empowering nurses, promoting women's rights, and advocating for quality healthcare. HSC, BSc Nursing, Mumbai University, post-graduation in nutrition, IGNO, diabetic educator course, and ILTS certification. Madam worked as a staff nurse in KM Hospital, sister tutor, KM Hospital, sister tutor, Bhagavati Hospital, sister tutor, LTMG Hospital, vice principal at LTMG Hospital. Madam organized conducted conference at Panchagani and Aurangabad, represented Maharashtra, winning a first prize for the best performance and activities. Over to you, ma'am.
Yeah. Greetings of the day to all the stalwarts present on this digital platform. Dr. Sue Khanna, patron and founder, and my adorable madam, and Dr. Binu Jo, president of NSS, Dr. Aisha Qureshi, madam, who is very lovely, and I'm in love with her, chief guest, Dr. Bimla Kapoor, and other stalwarts present here on this digital platform to laugh along with me, because it's very important to maintain our mental health, because it matters a lot. Lot of knowledge has gone inside. Now let it unwind by laughing a lot. So can we go to next slide? I'll just give you a little information about Laughter Club. And this is how I started my Laughter Club in Sion Hospital every day in the morning. So we used to get fresh, so the laughter yoga, unlocking the joy and well-being. Your well-being really matters. So, ha 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 ha, clapping, laughing, childlike play class, and laughter yoga. So this is very important for overall well-being. So let's come to the importance of yoga or laughter yoga. So next slide. What is laughter yoga? Laughter yoga is a unique exercise routine that combines laughter exercises with yogic breathing, and that is founded by or developed by Dr. Madan Kataria. In 1995, Dr. Madan Kataria created laughter yoga, a non-profitive meditative practice that involves breathing, laughing in Mumbai, and there are now thousands of laughter club amongst the whole universe. Now with us, whole universe is laughing because that aura is spent all over. Next. Physical benefits of laughter yoga: reduces stress hormones, that is cortisol and adrenaline, boost immune system. I was amongst all the people in the home around having cold, but I don't know from where I got this immunity, because of laughter maybe, and that is why I could present today. Then it lowers the blood pressure, improves your vascular health, and reduces pain. You just laugh and the pain disappears. That is a miracle of laughter. And laughter is the best medicine. Emotional benefits: reduces anxiety, depression, improves your mood. You have mood swings. Now, immediately from knowledge, we have come to mind. How transforming the power it has, the laughter yoga. Then enhance creativity and productivity, foster social connections and community building, increasing self-esteem. Next, sir, mental benefits. Improve your cognitive function and focus. all these presenters, they were focusing on something and presenting on something so beautifully, because cognitive function is activated by these hormones, adrenaline, serotonin, oxytocin. All these are neurotransmitters, and they are vibrated with the neurons. It enhances and stress management, which is very important. All of us go through stress, everyday life, here or there. Now, there was problem of network issue. There is a problem with my throat also, but I just tried. Support mental health and well-being, increases positivity and gratitude. Next. Next, sir. Muttu sir, next. Social benefits, build social connection and community, fosters communication and teamwork, breaks down cultural and social barriers, and encourages playfulness and creativity. So let's have some practical. Now, this was all information. Let's laugh together. Okay, so you will repeat after me. Now, keep your hand on the stomach. All of you, I request, keep your hand on this. Should I stand? Keep your hand on your stomach. Keep your hand on your stomach and say, ha. Keep your hand on stomach and say, ha. Keep your hands on the stomach and say, and after each this exercise, we have to have positive affirmation that very nice, 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 very nice. Okay, now keep your hands on your shoulder. Keep your hands your shoulder and say, very nice, 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 very nice. Now keep your hands your on your hip, waist or hip, and repeat after me. Very nice, very nice, very nice, very nice.
Very nice, very nice, very
Very
nice.
nice, very nice. Now keep your hands up and say, very nice, very nice, very nice, very nice, very nice, very nice, very nice. Now we have a milkshake in our hand. Whichever milkshake you love, take in 2 hands, pour in one,
Pour in one,
pour in another one.
pour in the other one.
Enjoying this drink, I'm enjoying this drink. Pour in another. Pour in another.
Pouring in another.
Very nice, very nice, very nice. Thank you so
Very
much for
nice,
giving
very
me this
nice, very
opportunity.
nice.
Laughter is the best medicine. So keep laughing and all worries will be gone. So thank you, Dr. Narula Khanna madam. Thank you, Muttu Sirji. Thank you, Aisha Kureshi.
Thank you, ma'am.
Madam. Thank you, Molly ma'am. And thank you all
Thank you,
the
ma'am.
dignitaries present on this
Thank you
platform.
so much.
Thank you
Thank
so
you,
much.
everyone.
All the
Thank
glitch.
you.
You
Thank you,
can
Meena ma'am.
relax now. You will all have nice sleep now.
Vinu sir,
Yes, ma'am.
Yeah, sure. Yes, madam.
Yes,
Vinu
madam.
sir wants to say something. Invite Vinu sir.
Benu sir, anything you want to say?
Yes.
Sir, please, sir.
Yes, actually, I want to thank on behalf of all our male. Thank you for the awards to we have the 5 persons who have been awarded by the committee. The committee who have shortlisted for us for the award, specifically under Vipin sir, Dr. Neeraja Madam, and all the committee members who have taken this initiative and scrutinized and did their work for awarding us on behalf of all Sandeep sir, Naveen sir, Sri Raja sir, and myself. I take this opportunity to thank all the committee members for awarding us. Thank you.
You're welcome.
Thank you,
Now
sir.
the last one, vote of thanks or something else is left?
Now I call Dr. Khanna ma'am for vote of thanks.
It's always hard to say goodbye when we all want to enjoy each other's company to the longest possible time. But reality is different. We need to get back to our committed responsibilities and my sleep. My sincere thanks to our chief guest and Dr. Asha ji. If she was not taking day and night this effort and taking these pains and responsibility, we wouldn't have been doing this international